Science Journal for Kids and Teens presents How Can Rats Help Fight Tuberculosis? Read by Miranda Wilson. Abstract. Can you imagine a rat sniffing out a disease? The African giant pouched rat can. Scientists trained these rats to identify if a person has tuberculosis, or TB. TB is a bacterial disease that most commonly affects the lungs. It spreads easily and can be dangerous if untreated. When rats smell samples of mucus a person coughs up, they can smell if it has TB bacteria. We wanted to know if rats are better at identifying cases of TB compared to a standard microscope test. We also wanted to know if rats can better identify TB in children than in adults. We found that rats can identify TB samples that the microscope test said were negative. We also learned that the rats are more likely to identify TB in children, even when they have low levels of bacteria. Using rats can help more people receive treatment for TB and reduce the spread. Introduction. There are many bacterial diseases that are very dangerous if left untreated. An important example is tuberculosis, or TB. Pulmonary TB is a lung disease caused by bacteria. A person with TB typically experiences coughing, fever, weight loss, and night sweating. The cough can bring up phlegm, sometimes mixed with blood. Phlegm is mucus that the respiratory system uses to protect itself from bacteria and viruses. Because bacteria cause TB, it is usually curable with antibiotics. Even though TB is a treatable and preventable disease, it remains the deadliest infectious disease in the world. Diagnosing TB is important. If people are not treated, they could die. For example, about 10.8 million people fell ill to TB in 2023. Many of these cases are in Africa. In 2023, 1.25 million people died from TB. Diagnosing TB can also prevent people from spreading the infection to others. The most common ways to identify TB are using a smear test or a molecular test. During a smear test, a person analyzes a sample of phlegm using a microscope. During a molecular test, a sample of phlegm is tested for the DNA of the TB bacteria. But another way to identify cases of TB is using trained African giant pouched rats. These rats can detect TB by smelling people's phlegm. How? Well, you recognize when you smell coffee because it's composed of chemicals specific to coffee. Similarly, the rats can identify the smell of TB because of several chemicals specifically produced by the TB bacteria. We wanted to answer 3 questions about rat detection of TB. 1. How does rat identification compare to the smear test? 2. How well do rats identify TB in children and adults? And 3. How does the amount of bacteria affect the ability of rats to identify TB? In this image, you can see the African giant pouched rat can be trained to smell TB bacteria in the samples. The top image shows a person with an African giant pouched rat on their shoulder. In the bottom image, you can see one of the rats working with samples in an enclosure. The samples are below the metal floor, and the rat can smell them through holes in the metal. Methods. We analyzed phlegm samples from children, men, and women in Tanzania from January to December 2022. We selected 35,766 patients who went to a health facility and who had one of the 4 TB symptoms. The health facility tested samples from these patients using a smear test or a molecular test. We used samples from patients who tested negative on that first test. We used trained rats to test each sample. We placed the rats on a floor with 10 holes. Each hole had a phlegm sample. The rats sniffed each sample. If they gave the signal, pausing for at least 3 seconds, we considered the sample TB positive. If they did not, we identified the sample as TB negative. We then confirmed any rat-identified positive samples using a more sensitive smear test. All patients with a positive result received treatment. If the more sensitive smear test is better at identifying TB, why don't doctors just use that one all the time? Why go to the trouble of training rats? Well, unfortunately, these tests and the molecular tests are also much more expensive. Countries with limited healthcare budgets rely on the smear test because it is so much cheaper, even if it doesn't catch all TB cases. We also determined the level of bacteria in all samples. Based on the number of bacteria observed, we classified samples as having very low, low, medium, or high levels of bacteria. Here in Figure 1, you can see a flowchart illustrating how patients were tested for TB to determine if they needed treatment. The top of the flowchart starts with patients with TB symptoms. They are then first tested at a health facility. If the result was positive, the patient received treatment. If the result was negative, they gave the samples to the rats to be tested. If the rat test was negative, the person did not have TB. If the rat test was positive, the samples were subjected to a more sensitive smear test. If the more sensitive test was negative, the person did not have TB. If the more sensitive test was positive, the patients were given treatment for TB. In the flowchart, the different tests can be seen in orange, the potential results in purple, and the treatment in white. Results. Number 1. How does rat identification compare to the standard smear test? The smear test identified 1,900, or about 5.3% of the patients as positive. Our rats identified an additional 2,029 cases of TB, so an additional 5.7% of the patients. They were also much better than the smear test at detecting low or very low levels of bacteria. In fact, our rats were 6 times more likely than the smear test to detect TB in patients with those lower levels. 2. How well do rats identify TB in children and adults? The rats identified 71% of the total number of children with TB. They identified 51% of the total number of adults with TB. Our rats were twice as likely to identify cases of TB in children than adults. And 3. How does the bacteria level affect the ability of rats to identify TB? When the samples had very low or low levels of bacteria, 2 or 3 rats out of the 5 identified TB in the samples. For samples with medium and high levels of bacteria, more than 3 rats out of 5 identified TB. Here in Figure 2, you can see the percentage of TB cases detected at low and very low levels of bacteria out of the total number of positive cases for each test. On the x-axis, you can see results from the smear test on the left out of 1,900 positive cases, and results from the rat test on the right out of 2,029 positive cases. On the y-axis is the percentage of positive tests. Very low levels of bacteria can be seen in light purple, and low levels of bacteria can be seen in dark purple. Looking at the graph, how does the percentage of positive tests identified by the smear and rat tests compare at very low bacteria levels? Discussion. We found that rats offer an effective method of identifying TB in adults and children. The rats identified TB in patients that had a negative result from the first test at a health facility. That means we can identify and treat more cases of TB. This treatment will also reduce the spread of the disease. It will also reduce the number of people who die from TB each year. Rats are more likely to identify TB in children than in adults. That means rats can help improve the diagnosis and treatment of children with TB. This will also prevent the spread of the disease and save lives. Getting treatment when there are still low levels of the bacteria also means less suffering for children with TB. The ability of rats to identify TB depends on bacteria level. As the bacteria level increased, more rats identified TB cases. This is similar to the smear test, but the data suggests that rats are better than the smear test at identifying cases when levels are very low or low. That is why using rats to identify TB can improve people's ability to receive treatment. Conclusion. There's a lot we can do to limit the spread of bacterial diseases like TB. Make sure to wash your hands and cover your mouth and nose when you cough and sneeze. Whenever you do not feel well, stay home and rest. This will reduce the likelihood that you will pass on bacteria to other people. You should also visit a doctor when you have symptoms of a bacterial infection. If you need medication, make sure that you follow the instructions. When people don't take their antibiotics as instructed, it can lead to stronger bacteria that are harder to treat with antibiotics. Our individual actions can help protect people in our communities from infection. Thank you for listening to this recording. This work has been adapted from the original peer-reviewed paper in the journal BMC Infectious Diseases, published on April 15, 2024. Research conducted by Tefera B. Agazo, Joseph Soka, Negusi Bayene, and others from Apopo Tuberculosis Department at Sokoine University of Agriculture in Tanzania. See the full list of authors and their affiliations in the accompanying PDF. Please visit our website, sciencejournalforkids.org, for more free science teaching resources.
Hey everyone, we're a small nonprofit and all of our resources are free. So if you like what you see, please subscribe and share.